One often overlooked aspect of the opioid epidemic is the connection to dental treatments. In fact, dentists and oral surgeons write 12% of all opioid prescriptions, including approximately 45% of opioid prescriptions for adolescents. So what should you do if you are prescribed an opioid? What questions should you ask your dentist? Well, joining us now with some answers this morning is Dr. Ted Wong, the Chief Dental Officer at United Healthcare. Welcome to the show, Doctor. Great to have you here.
Good morning, Heather, and thank you for having me on the show.
So when would somebody be prescribed an opioid when going to the dentist?
So as you said, 45% of opioid prescriptions are written by dentists for teenagers and adolescents. And the simple explanation is that's the age group where you're more likely to have your wisdom teeth removed. It's estimated that 5 million people a year have their wisdom teeth removed, and 70% of those are associated with a opioid prescription.
So how should a parent talk to their dentist if their child is prescribed an opioid after they get the surgery?
The important thing to keep in mind is don't be afraid to ask questions or have a serious discussion with your dentist about opioids. The first question I would ask is, do I really need an opioid, or is there another option for managing pain? If a opioid is recommended or indicated, then ask about how do I limit the amount or the supply or the dosage and the strength of that opioid. The CDC recommends no more than 3 days supply of opioids. We always tell our members kind of go low and go slow when it comes to opioids. As you go beyond 3 days, then you increase your risk of addiction to the drug.
It is such a big risk. So what are some of the other medications that a child or an adolescent would be prescribed in this instance?
So there are over-the-counter medications that could be used instead of an opioid. Recent studies have indicated that the combination of Tylenol and Motrin together will be as effective as an opioid without the risk of addiction.
I don't think a lot of parents would realize that. All of us as parents want to make sure that our children are comfortable after a major procedure, especially on your mouth. I think mouth pain is some of the worst pain that you can have. But that's interesting that you say that. Some of the typical medicines that we use for, common ailments being prescribed after something as serious as this sort of procedure.
Yes, and obviously these medications have been around. Dental professionals are always interested in managing pain both during and after a procedure. But as we learn more, get more research on the topic, we find that we have alternatives to opioids in managing dental pain.
Oh, very encouraging news for all of us, especially parents and teenagers. Thank you so much, Doctor, for joining us this morning and sharing all this new wisdom, so to speak.
Thanks for having me, and your viewers can go to newsroom.uhc.com if they want more information on this important topic.
Thank you, Doctor. You're watching The Morning Blend this morning. We'll be right back.